My name is Richter. I am in the master's program at UC Berkeley on the online MPH program. And one thing that I really like about public health is how it is basically a bunch of really talented, interesting people who want to make the world a better place. And the idea of being part of that community is very exciting to me. Everyone seems to be really excited to be here, and when you have a bunch of people who who are excited to be in a place, it makes the place even more exciting. And everyone's very intelligent and smart and kind, and we get to do lots of really interesting things. So I'm working on a few different projects. One is I am working on a needs assessment for migrant workers. So what happens with that is that we go visit vineyards where there are migrant workers working and do a health assessment and a health sort of checkup. So there are students from, it's a collaboration with Permanente and with Kaiser, and the medical residents tutor the students on, the Permanente students on sort of how to take health information from patients and how to talk to them and do workshops with them. And then we go and we set up, and the Permanente students get hands-on experience interacting with patients, and not just patients, but patients who may not necessarily want to be there. So they get the experience of working with a community that is important to them, because most of the people, not most, but a lot of people in the Permanente program have family who are migrant workers, so they get the experience of going to a place that is sort of dear to them, and people who are very similar to people who are dear to them, and get that community engagement. And then so they get these patients to help fill out surveys. And then if we identify that there are health needs that those patients needs, we'll refer them to get more help. So what I like about it is it's not just sort of a helicopter situation where you come in, you drop out, you take data, you run away. But it also helps these people get connected to a medical home. So and then once we collect the data, then we analyze it and find out if there are things that we can learn for the next year or to help them better in the future. Another project that I'm working on is related to the diabetes centering classes that we do here. So we're interested in expanding them because they have been showing really good results. So a lot of people think that quality improvement is you find something that is bad and then you make it better. But there's also an ideology, if you find something good, then you can make that better too, and you can build on the strengths that are there and take that into the future. And so that's sort of what we're doing with this program, is we've already figured out that it's really strong and good, so we're building on those strengths and we're adding more things to make it even stronger. So we're still in the beginning phases of doing research and developing the plan for how to make it better. But the idea is that we will eventually create a program that is longer and is better able to support the patients in their lifetime of diabetes self-management rather than just a class. And then I've also been helping out with mapping out sort of what the processes of various departments are who help people with IBS, to see if there are opportunities for integrating them better. So I think those are the three main projects that I'm working on. I would like to go into sort of program planning and evaluation. So getting the opportunity to work on the diabetes centering classes is really cool, because I get to see what's working and then make it work better, which is sort of what I want to do in the future. Getting the chance to actually work on this diabetes program in a hands-on way. So I've done that. I've done hands-on program planning and evaluation for class, but when we did it in class, it was very figured out and set up. So it seemed like everything would work perfectly. And getting to do it in a setting where there's a lot more people involved, you get to see how iterative it is. And I really like that, getting able to see, it doesn't always work the same way that it will in class. Sometimes you have to do other things, and being able to manage those other things that we didn't anticipate in class.